Welcome to the Montgomery County Public Health site and congratulations on the birth of your new baby. Today we're going to be discussing some tips about breastfeeding. Breastfeeding is the best nutritional intake your baby can have. Breastfeeding is a natural experience and it also has to be practiced and it has to be learned. Let's review a few key pointers. It is a learning process for both you and your baby. Mom, you have to learn how to do positioning and know your baby cues, and the baby has to learn how to latch and suck on the nipple properly. You'll want to begin feeding when both you and your baby are relaxed, calm, and alert. Mom, you should be in a comfortable position to feed. Pillows can help you avoid with back or neck pain, and you'll want to help with positioning to keep your baby level with your breast. Also, you can use a pillow to support your baby's weight, keeping their nose in line with the breast and nipple. Let's go over some key breastfeeding positions. The first one is known as the cradle position. Your arm is supported, your baby is in nice alignment with your breast, and they are completely facing you. The next one is called the football or the clutch hold. This is where you take your baby and their feet and legs are positioned on the side behind you. For this position, you place your hand under the baby's head, make sure they're in good alignment with the breast and latched on properly. The next one is called the lying down position. This is where both you and the baby are on the bed. As lying down, Mom, you're laying down and you're placed on your side with the baby next to you. You can support the baby by under their head or under their bottoms, and just make sure that the head again is aligned with the breast and the baby should be facing you as both of you are lying down. To get a good deep latch, support your breast and help the baby get the nipple deep into their mouth. Wait for the baby to open really wide, then lead with the chin and draw the nipple into the mouth. The nipple should end up near the back, soft palate behind the hard roof of the baby's mouth. Remember, you want to bring the baby to the breast, not the breast to the baby. We like to see that the baby's lips are flanged out and that their baby has nice wide angle for good latch and suction. One key question new moms have is, how do I know my baby's getting enough? Well, when latched on properly, you can hear the baby swallow, meaning the milk is transferring from the breast to the baby. Another key is that your breasts are softening after a feeding. And also, too, by counting your baby's wet and dirty diapers. In an average of 24 hours, your baby should have anywhere from 6 to 8 wet diapers and 3 to 4 dirty diapers. Another question moms have is, how long does my baby nurse? Well, we kind of let the baby kind of tell us, how long they're going to nurse, because we really don't know how hungry they are. So babies can nurse anywhere from 5 minutes to 45 minutes. A lot of times babies have what they call cluster feedings, where you're thinking that they're eating like they want to eat every hour on the hour. And that will subside over time as they start getting on a routine. Sometimes most babies do fall asleep when they are feeding, and they'll self-detach themselves when they're full, but some babies like to just stay on and attach to moms just for comfort. If this happens, you can detach your baby from the breast. What you can do is use your finger, make sure your hands are clean, just slide it down the side of your breast and into the corner of the baby's mouth. And this should break the suction and the baby should slide off. In the first few days and weeks, new moms may experience what we call nipple soreness. This can be eased by applying some breast milk to the area and letting it dry, or you could apply some nipple ointment cream, also known as lanolin. If the soreness persists, maybe the baby is not in a good position or has what they call an improper latch. Another concern new moms may have is engorgement. Engorgement is not normal. This is where the breasts may become very hard and lumpy and the milk does not pass through properly from the breast to the baby. What you can do to help prevent this engorgement is offer frequent feedings to the baby to help softening that breast and releasing that milk more often. Or you can do what they call hand expressing. Better yet, if you have a breast pump, I would encourage you to breast pump every so often in between feedings to help release some of that buildup of milk. You can also place ice packs on the breast after feedings. Do it in 10-minute intervals. Be careful to note though, if you develop a fever or if your breast has a red hot spot on it, you'll want to call your doctor. This may be a sign of infection known as mastitis. Just remember, perfecting this partnership does take some time. Remember the 4 P's: positioning, practice, patience, and persistence. If a mother meets those 4 P's, usually she will have a successful breastfeeding experience. Once again, congratulations on the birth of your baby. For additional information or a free booklet on breastfeeding, please contact the Montgomery County Public Health Department at 518-853-3531. Thank you.